Welcome back to part 3 of SUNY Delhi's Right to Know and Hazard Communication Training. In this part, we'll discuss toxicity as well as some other hazards. Toxicity is the ability to cause injury to living systems. Neurotoxins, which would have effects on the nervous system. Hepatotoxins, with effects on the liver, while nephrotoxins affect the kidneys. Dermotoxins, the skin, and cardiotoxins, heart muscle. The four routes of exposure: inhalation through breathing, ingestion through eating or swallowing, absorption through the skin, or injection by the means of a sharp object, whether that be a needle, syringe, or a piece of glass, something of that nature. Acute versus chronic toxicity. Acute, these effects appear promptly after exposure, usually within the first 24 hours, while chronic, these are delayed effects following repeated or long duration of exposure to a substance. Dose and response concept. This is the effect of a chemical depends upon the amount and duration of exposure. A substance could be helpful in small doses, the drug remedy, but harmful in larger doses, poison. Many over-the-counter drugs can be fall into this. Acute toxicities are adverse effects occurring following oral or dermal administration of a single dose of a substance or multiple doses given within 24 hours or in inhalation exposure of 4 hours. Acute toxicity of inhalation, here's a little category, hazard categories for potential chemical hazards with an acute toxicity hazard. Hazard category 1, again, your most severe hazard would be accompanied by the signal word danger, hazard statement of fatal if inhaled. And the pictogram in this case is your skull and crossbones. Again, these are acute toxicity, oral, fatal or toxic. Think of your poisons. Categories 2 and 3 share the signal word danger. Category 2 has a fatal if inhaled hazard statement, while 3 has a toxic if inhaled statement. Both of these, again, are accompanied by the skull and crossbones pictogram, while your category 4, your least severe of the acute toxicity hazards, has a signal word of warning, hazard statement harmful if inhaled, and you'll have the exclamation mark pictogram. This chart just gives you an idea of the potential for different substances. You'll see at the top left it says agent, and that lists your chemicals. On the right it says LD50. This is lethal dose 50. This is what they measured during experiments and while they're determining the lethal dose of a substance. The lethal dose 50. 50 means that in cases during testing, 50% of the test population, the dosage that's listed here is fatal. So in ethanol, for instance, your lethal dose, 50% of the population, is at 10,000 milligrams, where nicotine, the lethal dose, is 1.0. Corrosion versus irritation. Similar but different. Irreversible tissue damage would follow your corrosion hazards. This is noted and accompanied by the corrosion pictogram, which again is a red diamond with a hand and a bar underneath. Above those, there are test tubes pouring a substance onto those, and upon closer examination of this pictogram, you'll see there's an actual indentation in the hand and in the bar. Again, this is irreversible tissue damage. Think scarring, think your acids, things of that nature that will actually leave almost a divot. Where your reversible tissue damage would be accompanied by the exclamation point hazard. This would be things like redness, swelling, things of that nature. Respiratory sensitizers, these are chemicals that will lead to hypersensitivity of the airways following inhalation. You'll have the health hazard pictogram on the right. the human silhouette with the star on the chest. While skin sensitizers, these are chemicals that lead to an allergic response following skin contact. Again, that is the exclamation mark hazard. Other health hazards, your carcinogens, known, presumed, or even suspected, germ cell mutagens. These cause genetic changes which can be passed on to offspring, and reproductive toxins, adverse effects on sexual function and fertility or development of offspring. STOT, or specific target organ toxicity. These chemicals target a specific organ, whether it be liver, heart, kidney, lungs, etc. A couple new hazards added. Something to keep in mind when they are not accompanied with a pictogram as of now. The simple asphyxiants, you'll have a signal word of warning. These chemicals may displace oxygen and cause rapid suffocation. Combustible dust, another signal word of warning. A hazard statement may form combustible dust concentrations in the air, and again, no pictogram. Stay tuned for part 4.